Over the past several months, we've learned a lot about the physical impact of COVID 19, but what do we know about the mental health implications? Holly Oxhandler is a mental health expert. She is the Associate Dean for Research and Faculty Development, an assistant professor and researcher in the Diana R. Garland School of Social Work at Baylor University. She joins Newspoint today to look at the role of spirituality and religion in the treatment of depression and anxiety. Dr. Oxhandler, thank you so much for taking the time today.
Absolutely. Thank you so much for having me, Sharon. I'm honored to be here.
Well, from isolation to the fear of the unknown, what is the evidence telling us about rising rates of anxiety and depression?
Yeah. Well, I think, first of all, I want to clarify that there are a lot of ways in which we are still learning a lot about the rates of anxiety and depression and the implications of what we're navigating right now as a country, particularly as it relates to COVID. But what we are seeing right now is that there is a rise. We're seeing some data, some early data that's coming in, particularly from crisis text lines and hotlines and such. And the numbers are staggering. So, for example, what we saw from the crisis text lines in April of 2019 was that, these numbers are from the Substance Abuse and Mental Health Services Administration. We saw that in April 2019, there were about 1,800 texts to the crisis text line. Now, in April 2020, that number has jumped to 20,000. So these numbers are staggering in terms of identifying the need that individuals have as they cope with what we're facing right now, and the many ways in which it has this domino effect on our lives. So we're seeing those rises, and then in particularly, we're also seeing that with the crisis text line, when folks are finishing up their conversation, they're asked, particularly around any stress or anxiety related to coronavirus, and about 78%, again back in April, said that yes, they are experiencing anxiety and stress related to the coronavirus.
Well, you've done extensive research into this area. What is the link between religion, spirituality, and mental health?
Yeah. So what we're seeing when it comes to this intersection between religion and spirituality and mental health is that it is both religion and spirituality can both be a wonderful source of support and space in which folks can lean on and navigate some of their mental health struggles that they're facing. But we also see that there are ways in which one's faith can be negatively woven into their mental health struggles. For the most part, what we do see in the research overwhelmingly is that those who tend to lean on their religion or their spiritual beliefs and practices tend to have much better outcomes when it comes to coping with their mental health struggles. We have seen this not only in some of these studies that just look at one time point, but we're starting to look at more long-term studies that show that truly when they integrate their faith into mental health treatment, it positively impacts outcomes. And there are a number of different ways that can be, but I do want to touch on a few ways in which that link is really important. First of all, I mentioned the treatment outcomes piece and how this is impacting outcomes. We're also, as I mentioned, seeing this in terms of coping strategies that individuals will turn to perhaps their higher power to wrestle with, why is this happening? Or, I don't understand. How do I navigate this? They'll turn to their faith leaders or communities for support. And then this is especially true in terms of what we're seeing right now, where this illusion of control that we have had seems to be gone in a lot of ways. And so when there is that loss around the illusion of control, we're seeing that folks are turning to their mental health or to their faith much more. So in some of the studies that have been reported over the last few months, not only are individuals reporting higher levels of anxiety and depression as it relates to COVID-19, but they are also communicating that they feel as though they're deepening their faith practices and they're tying in some more of their faith journey in ways that perhaps they haven't really been thinking about for a long time. So it's been really interesting in this season to kind of watch these two go hand in hand. Yeah.
Well, as I said, you've done a lot of research in this area. How
Mm.
can spirituality work in tandem with other mental health treatments?
Yeah, no, that's a wonderful question. Thank you for asking that. So, we do have a number of mental health treatment modalities that it would be really easy to weave in things around religion or spirituality. So, oftentimes I think of like cognitive behavioral therapy, where we are thinking of individuals' thoughts and their behaviors. And, when I was a practitioner and working with older adults with anxiety and depression, I had a lot of clients who would use phrases like, God will never give me more than I can handle, or, my higher power will always be there to help me navigate through the day. And so some of those coping statements can be woven in. Certainly, behaviors is another really important piece where individuals may engage in some of their religious practices or habits that might help them to cope with some of the day to day stuff. So that's kind of where we're seeing some of this in terms of, navigating directly in treatment and perhaps more specifically in like cognitive behavioral therapy. But also, when we think about both the strengths and the struggles associated with religion and spirituality, we see that clients will come in and they'll say, that their faith was a piece that helped them to reframe a certain situation or something that they were going through, or maybe certain practices like gratitude or yoga or forgiveness, or some practices that may be more specifically tied to their faith tradition are ones that they're leaning on to navigate those circumstances. But I do want to be sure, if it's okay, to mention too that certainly sometimes faith, it can be a great source of support, and communities can be a great source of support. But there are times when individuals struggle with spiritual trauma or abuse, or, I think of those who suffer with obsessive compulsive disorder. And there is a layer of that for many that's called scrupulosity, which is another diagnosis where individuals will engage in a lot of religious activities to try to alleviate that anxiety. And so there are ways that the religion and spirituality, it can be negatively woven into what's happening. So it's really important for us, especially as mental health care providers, to be sensitive to this area of clients' lives.
Absolutely. But taking a positive spin, what are some of the barriers to incorporating spiritual health into traditional mental health treatments that you're seeing?
Yeah, that's a great question. So that is one area that I have loved to do some more research in. And we've done some big surveys looking at mental health care providers around those barriers. What we see in terms of those barriers are often there a lack of training that mental health care providers receive. And some of that is just there. This is a more recent, relatively recent topic for mental health care providers to be wrestling with. It really hasn't been until the late 1980s that we really started looking at this more carefully after not looking at it for decades before then. And so not having a lot of training in this area is really important. And a big barrier. We see that a lack of comfort for mental health care providers to discuss this is another barrier that they report. They don't have as much knowledge on various religious or spiritual traditions or beliefs or practices. And they really struggle in terms of how to integrate this. So without having someone offer some concrete, here's some assessment tools, or here are things to be on the lookout for. Here's how you refer a client to a faith leader when it really is more of a faith issue than a mental health issue. Without those areas of training, they really struggle. We also see that a lot of clients aren't really sure if this is an area that they can talk about. We know that nearly 80% of US adults consider their religion to be at least somewhat or very important in their lives. And yet, when they come into the mental health treatment space, they don't know if this is an area they can talk about. And there is that power differential between the therapist and the client, where the client's like, can I talk about this? It feels like it's a taboo topic. And meanwhile, the therapist is thinking the same thing. It feels taboo to them. And so it sort of becomes this elephant in the room that neither is really sure how to navigate. And so ideally, I would say that it would be best if the therapist is the one to bring it up and to talk about it. And even if that just looks like including it within the initial assessment, just asking a couple of questions about the individual's religious or spiritual journey. We also see limitations around the agency or the setting that the practitioner is working within, whether they have feelings for or against this topic and how to navigate it, if there is financial support or not. I'm mindful of the ways in which we try to separate church and state. And so the VA is a place that often is trying to navigate, how do we talk about this? But what I really want to help offer some encouragement, especially for mental health care providers, is that if we have growing research that talks about ethically integrating clients' faith into mental health treatment as being something that improves outcomes, then from what we call an evidence-based practice process perspective, we really need to be thinking about that research and weaving it in to the work that we do with clients to best serve them and their needs. So those are some general limitations, I think. I will say that we recently wrapped up a national survey of current mental health clients and asking them about some of these same questions about barriers and the degree to which therapists are asking about this. And so hopefully we'll have some of that data out soon.
Well, during this time of great stress, your message is an important one. Do not overlook your spiritual and mental health. Dr. Oxhandler, thank you so much for your expertise and sharing with NewsPoint today.
Absolutely. Thank you so much, Sharon.